What if I told you that a simple gel, yes, just a gel applied directly, could help you achieve an erection in as little as 10 minutes? No prescription required. No awkward pharmacy wait times. No sitting around for an hour waiting for a pill to kick in while the mood slowly drifts away. It sounds almost too good to be true, doesn't it? Like something out of a late-night infomercial. Well, today we are going to look at the clinical reality behind a brand new FDA-approved topical gel that is already starting to change the landscape of how men manage erectile dysfunction. But here's the catch. While it can be a total game changer for many, it isn't magic, and it isn't for everyone. Before you rush out to clear the shelves, we need to separate the biological facts from the marketing hype. And real quick, before we dive into the science, if you value honest, no-nonsense men's health advice that puts your dignity first, go ahead and hit that like button, subscribe, and drop a comment below telling me where you're watching from. I love seeing our community of men from all corners of the globe coming together to take charge of their health. Here is something vital you need to understand. Erectile dysfunction is not just about the penis. For decades, men have been sold the idea that ED is purely mechanical, a simple plumbing issue. The message was always, take a pill, fix the pipe, problem solved. But the truth is far more elegant and complex. An erection is the result of a beautifully coordinated symphony involving your brain, your nerves, your hormones, your emotions, and of course, your blood vessels. When even one instrument in that symphony is out of tune, whether it's stress-induced cortisol, high blood pressure, dipping testosterone, or prostate changes, the whole performance can suffer. That's why I always tell my patients, ED isn't just a bedroom inconvenience. It is often an early warning system for your cardiovascular health. It's your body's way of whispering to you that your blood vessels might not be as flexible or healthy as they should be. So, when a new tool like this gel hits the market, my job is to help you understand where it fits into the bigger picture of your long-term vitality and confidence. If you're new here, I'm Dr. Jocelyn. I'm a urologist, and for the last 5 years, I've focused my practice on helping men reclaim their edge, protect their prostate health, and strengthen their most intimate relationships. I've sat across from thousands of men in my clinic, men in their 40s, 60s, and 80s who struggle quietly with these issues and don't always feel they have a safe space to talk about it. Consider this video your private consultation with me. We're going to speak openly, honestly, and without a shred of judgment. So, what exactly is this new kid on the block? It's called erection. It's a topical treatment that you apply directly to the glands, the head of the penis. You take a pea-sized amount and rub it in gently for about 15 seconds. The biology. What happens next is a fascinating bit of physiological engineering. You'll first feel a distinct cooling sensation, followed by a gradual, deep warmth. This rapid temperature shift isn't just for show. It stimulates the highly sensitive nerve endings in the glands, triggering the local release of nitric oxide. If you've watched my other videos, you know that nitric oxide is the chemical spark that starts the engine. It tells the smooth muscles inside the erectile chambers to relax, which allows blood to rush in and create firmness. The practical reality. Here is the key. The gel won't just give you an erection out of nowhere while you're grocery shopping. You still need sexual stimulation. The gel essentially primes the system and lowers the threshold for an erection to occur, but your arousal and your partner still provide the fuel. Emotionally, this is actually a benefit. It makes the experience feel more natural and less like a medicated event. Now, does the data back up the hype? Let's look at the numbers. In 2023, the European Society for Sexual Medicine looked at a trial comparing this gel to tadalafil, the active ingredient in Cialis. They took over 100 men with varying degrees of ED. The results: 61% of men using the gel reported a meaningful improvement in their erections. Now, tadalafil scored higher at 87%, but that doesn't mean the gel lost. It means that for men with mild to moderate ED, the gel is a very effective, non-pill alternative. The speed factor. In another study of over 1,000 men, the headline result was that about 60% of men achieved an erection within 10 minutes. Compare that to traditional pills, which usually require you to plan 30 to 60 minutes in advance. That 10-minute window is a massive emotional win. It protects the spontaneity of intimacy. You don't have to break the mood by saying, "Hold on, let me go find my pills and wait for them to work." Because the gel acts locally and isn't absorbed into your entire bloodstream in large amounts, the side effect profile is remarkably low. Side effects. In trials, only about 4% of men reported mild issues like a temporary headache. Traditional pills can sometimes cause systemic issues like flushed faces, indigestion, or blue-tinted vision. The heart health win. This is perhaps the most important point. Many men on heart medications like nitrates for chest pain are strictly forbidden from taking Viagra or Cialis because the combination can cause a dangerous drop in blood pressure. Because this gel acts locally, it is generally considered a safe option for those men. But always check with your own doctor first. Is it a magic bullet? No. If your ED is caused by advanced nerve damage from long-term diabetes or extremely low testosterone, a topical gel might not have enough punch to overcome those hurdles. If you try it and it doesn't work, don't feel discouraged. It just means we need to dig deeper into your systemic health. If you're dealing with mild to moderate ED, or if you've hated the side effects of pills, this gel is absolutely a tool worth having in your toolbox. But don't stop there. To truly stay strong on demand, you need a foundation. Fuel the blood flow. A heart-healthy diet rich in leafy greens and healthy fats keeps your natural nitric oxide levels high. Move your body. Strength training and pelvic floor exercises. Kegels are like weightlifting for your performance. Manage the stress. High cortisol is the anti-testosterone. Find 10 minutes a day to decompress. Support the prostate. As we age, an enlarging prostate can quietly interfere with blood flow. Consider natural supports like saw palmetto or beta-sitosterol to keep things running smoothly. I want to pause and talk to the man who thinks, "Doc, I've been out of the game too long. It's too late for me." In my 5 years of practice, I have seen men in their 70s and 80s rediscover a vibrant, fulfilling, intimate life after years of silence. It is never too late to reclaim your confidence. Erections are about more than just sex. They are about your dignity, your connection with your partner, and feeling like the captain of your own ship again. You are not broken. You are a complex biological system that sometimes needs a tune-up. Whether you use a new gel, a traditional pill, or lifestyle changes, the goal is the same: freedom and confidence. Gentlemen, your best years are not behind you. They are happening right now, and they can be full of comfort, freedom, and vitality. Don't just chase a quick fix. Build a foundation of health that supports your heart, your mind, and your performance for the long haul. I want to hear from you. Would you try a topical gel for the speed and convenience, or do you prefer the traditional pills? Let's get a conversation going in the comments. I'll be down there responding to as many as I can. If you found this helpful, hit that like button and share this video with a friend. Sometimes the most important conversation is the one we've been too shy to start. I'm Dr. Jocelyn. Take care of yourself because you are worth it. I'll see you in the next video.